Your hometown news station, AM 1300 KGLO, streaming live online as well, KGLOAM.com, as we're going to be talking about measles today. There's been an outbreak of measles in southern Iowa with 17 cases confirmed now and evidence of person-to-person spread. We're going to take some time to talk about the outbreak and what we should be thinking about here in north central Iowa and doing and paying close attention to things, as well as weighing questions and about risk and immunization. We're joined today by Dr. Analisa Habermann, a health officer for the Cerro Gordo County Board of Health, as well as Jeni Stiles, the lead disease prevention nurse at the Cerro Gordo County Department of Public Health, to talk more about measles. Thanks again for joining us both.
Thanks for having us.
Yeah, thanks
You
for
bet.
having us.
Yeah.
Well, maybe we should just first of all talk about, some people may not know what measles is because something that we hasn't really surfaced in the news a lot in the last few years, but is now. Maybe we should just talk about what is measles.
Sure. So measles is going to be a virus that actually was eradicated like in the United States for quite a few years. But now that we're seeing our vaccination rates drop, then we're starting to see some of those cases pop up. We're up to date. We're at about 2,777 cases throughout the U.S. just in the year 2026 so far.
And that's and obviously the 17, like I mentioned here in Iowa, and that's it's got to be, like you say, it was eradicated, and it's got to be alarming that it's back in our back in our minds now that we have to think about this, right?
Right. I became a doctor in 2000,
Right.
and that's the year that measles was eradicated. So I have never actually seen a case of measles other than in a book or online. But I am pretty certain that I'm probably going to see one now with the way that things are. We have 12 cases confirmed so far as of August 17th, mostly in southern Iowa. But we expect that to be spreading, and we get our public health updates later in the week, every week. And so we will probably be seeing higher numbers of that later this week. The incubation period for measles is quite a while. It can be up to 21 days after exposure. And so it might take a bit for people to realize that that the measles has spread. And so super contagious. And if you haven't been vaccinated and you are exposed to measles, there's about a 90% chance that you're going to get it. So super important right now if you haven't been vaccinated, or if you are thinking that you have a child that hasn't been vaccinated, maybe you've decided to delay vaccines, but you want to, at least get that MMR or even do the MMR early. Talk to your provider about getting that done.
And like you were alluding to, obviously this is person-to-person spread, and I know. The advisory that the state health department put out yesterday, it showed places like Ottumwa and even some places in Des Moines where previous contact points could have been, and that's obviously the biggest thing. It's a person-to-person contact thing.
Yeah, and the one thing we worry about is people are contagious for up to 4 days before they even show any symptoms themselves. So when they're out in these areas, this virus lingers for 2 hours. So even though they've left the area, that virus is still there, trying to find its next host.
Vaccination. Talk a little bit more again about vaccinations and what people at this point should be thinking. Maybe they don't know if they've ever had any MMR vaccine or anything like that. I know you're getting a lot of questions right now from children and adults alike. For children and adults alike,
we're getting a lot of calls in the doctor's office. So, like I said, measles was eradicated from the United States in the year 2000, and it is felt that if you are an adult born before 1957, that measles was endemic at that time, and so you are immune. It is felt that you have had the disease and you are immune, and that no titer and no MMR is needed. Those are the current ACIP guidelines. If you are an adult born between 1963 and 1967, it is recommended to get 1 dose of MMR vaccine. If you are a healthcare worker born in those age groups, then you need to have 2 doses of MMR vaccine. Titers are okay, but it is recommended to go ahead and get the vaccines, as those are more effective. And we're getting it. We need to get this taken care of. Children are vaccinated at age 1 with their first MMR, and then their second one at age 4. However, if you have a child, or you will be traveling internationally, or you are worried about exposure, there is an accelerated schedule that you can talk to your provider about, where you can initiate the vaccine early at 6 months and then do the second vaccine 28 days later. However, you will have to resume the regular vaccine schedule at age 1 and still get the following MMR at age 4. So
what if you have no clue if you've been vaccinated or not in the past? What should you do then?
Yeah, if you have no clue if you've been vaccinated or not, you can't find your records as a child, then we recommend 1 dose of MMR.
Okay. Talking about, early, what are the early signs of measles for if somebody thinks maybe they have been exposed and not realized it right away?
Yeah, so usually, like she said, the incubation period can be up to 21 days. The symptoms usually appear between 7 and 14 days. You're going to end up with usually like a cough. We think of the 3 C's. So they're going to have a cough, they're going to have a runny nose, and then they're going to have red and watery eyes. The rash usually breaks out about 3 to 5 days after symptoms begin, and then a high fever, of course.
What are the long-term effects if you get the measles and it's not treated?
Sure. I mean, there are many things that like measles can lead to pneumonia. Measles can lead to swelling of the brain. And I mean, it can even cause death. One of the things that they do look at now is immune
amnesia.
There we go.
Right.
Sorry, lost the word for a minute.
Yeah, and immune amnesia is where the measles can continue to affect your body's immune system even after the infection has gone away. And it can damage your immune cells even the further away that you get from the infection. So this is actually something new that we're studying. But really the message here is that we need to prevent the measles. We've done such a good job until the recent time. This was eradicated in the U.S. and I think we can get there again.
Mm-hmm. Why are people not getting vaccinated, do you think? I mean, I hate to ask if it's a political thing or not, but I mean, it seems like it is, unfortunately. And like you say, here's something that was eradicated 25 or so years ago, and now it's unfortunately popping up in our society again.
I think a lot of it is, changing in like the generations and that. And, like she said, it's been eradicated for so many years that I think what happens is people don't hear about it and they don't see it. It's kind of like when we talk with parents about, the importance of back to school vaccines, and they say, well, there's not polio. Well, there's a reason there's not polio, and that's because we've gotten rid of it with vaccinations. So I think just education, making sure that people do know that vaccines are very safe and they're a safe way to keep our communities safe from disease.
All right. Anything else we need to hit on before we let you go?
Nope. If anybody's looking for immunization records, you can give us a call at CG Public Health at 641-421-9300, and we can look those records up for you. If anybody needs a vaccine, needs an MMR vaccine, we do have that available. If you don't have insurance, we have free vaccine for you.
I suppose we'll be talking about flu vaccines pretty quick, won't we?
Right around the corner.
It's hard to believe with school starting, and then all of a sudden we get into that flu season stuff, and then we just need to keep on top of it. That's probably usually the biggest thing, right?
Yep.
All right.
Yep.
Jeni and Analisa, we appreciate you joining us and trying to get more people aware about measles in the community. So
sure.
Thank you very much.
You.
Dr. Analisa Habermann, Health Officer of the Cerro Gordo County Board of Health. Jeni Stiles with CG Public Health here in Mason City, talking more about measles here on your hometown news station, AM 1300 KGLO.